Okay, let's go ahead and begin. Welcome to Protecting Public Health, Urban and Rural Heat Resilience Strategies. This webinar is the third in a series of webinars hosted by the Medical Society Consortium on Climate and Health. This series is part of the Climate and Health Equity Fellowship, a program being conducted in cooperation with the National Medical Association's Southeast region to support the leadership of physicians of color in equitable climate change and health. This includes policy development, community education, and advocacy. I'm Dr. Mark Mitchell, the Director of State Affairs for the consortium. Also joining me from the consortium to run this webinar are Dr. Kimberly Williams and Bev Harp. They will be available through the chat to answer any technical questions during the webinar. This series of webinars will be held for 1 hour on the second Friday of each month from 3 p.m. to 4 p.m. Eastern. Today's webinar will be recorded and made available on our website for future viewing. Today, we are honored to have two outstanding presentations on heat entitled Protecting Public Health, Urban and Rural Heat Resilience Strategies. As you may know, heat is a leading weather-related killer, causing more death to people in cities in the middle latitudes, such as St. Louis, Chicago, and Philadelphia. As global warming continues, the threat to outdoor workers in the South and those without air conditioning is increasing. Today, we're thrilled to have two outstanding heat policy advocates from Florida. The first presenter is Dr. Cheryl Holder. Dr. Holder is a board-certified internal medicine physician and faculty member at Florida International University, Herbert Wertheim College of Medicine. Rather than using our time to provide further description of her impressive accomplishments and information about the work she does, we're placing a link to her bio in the chat. Thanks, Bev. Our second presenter is Jeannie Economos. Jeannie is the project coordinator of the Pesticide Safety and Environmental Health for the Farmworker Association of Florida. You may also find a more detailed description of her extensive experience in the chat. We appreciate that their time and experience in sharing with our community of climate and health advocates. The general format for today's webinar will be a 20-minute presentation by each of our speakers, followed by 15 minutes of questions and answers from you, our audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for the presenters in the chat box at any time during this presentation. We'll get to as many questions as we can during the Q&A period at the end. Please keep yourself muted so we're not interrupted by background noise. Dr. Holder, you may begin.
Good afternoon, everyone. I'm going to share slides. I wasn't quite sure how much information to give. Since the health message is so large in heat, and then the policy issues are all very new, so I tried to combine both. So let me just make sure I got it right. How do I move it forward here? It's not going. Enter. This slide's not going. Okay, I have no disclosures. Hopefully at the end we'll learn what is extreme heat, some health impacts, some solutions, and how we can prevent it. I always start off with anime. If you have anyone seen my TED Talk, which I looked at the participants, I saw some names that I know. And anime was what got me involved in the whole climate world at a different level, having done environmental justice and those other types of work, but bringing it all together was anime. That's not her, but she reminded me so much of her. And the history I kind of pulled together so you couldn't identify my patient. But this is essentially a person who had a lot of health issues and had her COPD and breathing issues. And it was a very hot summer, which triggered all her health problems and then caused her to run up a huge bill. And so it gets us to extreme heat. And what exactly is that definition? Now, it varies based on where you live, because what's considered normal summer heat for that environment, and then when you're much higher than average. Another way that another site gives you to think about, when it's above 90 degrees for at least 2 to 3 days, with the heat and humidity combined. And you remember, heat and humidity makes it feel hotter. So that's when we talk about a heat index. So the thermometer may say 80 something, but it really feels like 96 or 90 something degrees. And that's what's really important, because that's what drives your health and all the side effects. And Dr. March just said it, extreme heat is the highest cause of death among all weather-related disasters. And when we look at Florida and the Southeast and the southern states, we're looking at a potential devastation as the climate warms. And we're seeing it here. By 2016, we had some of our highest days. And you remember, in the extreme heat, it's that it stays high in the daytime and doesn't cool at night. And of course, it has lots of effects. And so you have your direct effects from the heat, then all the indirect effects, where you have the increase in the ground level ozone, which then triggers all the other problems with the lungs, and the problems with dehydration from all the heat, which we have seen linking to a lot of the birth outcomes that we're now seeing. So beyond just the pollution, but just the heat and dehydration and premature labor. So there's so much more. I get to this case, and if you ever get the slides and you can link it, I won't turn it on today, but this person was what I saw in the news. And she was arrested after fighting with her family member about the heat, about a fan. And after the arrest and her subsequent death, because her COPD was exacerbated, and they sent her back home to a house, which we understand was continued to be hot. So this is a lack of understanding of the heat and what that does in our communities. And of course, again, more on the mental health effects after extreme weather events and what we do with all these problems, and especially with heat, because we know that heat increases interpersonal violence. Just heat, all aspects of our body is affected, from the head all the way down, arms, legs, lungs, heart. It's multisystemic, it affects everyone, and it is very deadly. And most of us think about heat. And when you think about heat illness, everyone thinks more about the direct effects. Oh, I got a heat rash and a sunburn and the cramps and the exhaustion, all the way to a heat stroke. This is what we often see in athletes and outdoor workers. And if you've ever been to a summer concert or those park events, these are the things that we're concerned about. But this is just the tip of the heat problem, because this is the ones that you kind of think about and expect. But what we just saw with my patients before is what we're looking at across the entire US and the world. And this didn't just happen by chance. We know that your ill health is really a result of your social determinants, where you live, where you work, where you play, the policies that drives this, your access to money and power, which can then protect you from the heat. And for low income and minority communities, we know that these social determinants have worked against our communities. So it is no surprise that, again, exposure to particulate matter is much higher in Black and Brown communities. Many of the homes that the community lives in are inadequate. And the cost of just keeping this low cooling and trying to maintain any kind of health is even larger for the poorer communities. So the cost burden is high, where you pay a larger percentage of the little income you have in energy. And some populations, and I use the Latin population because I work in Miami in South Florida. And when you think of where the Latin population lives, California, Texas, Florida, we're looking at high heat states. And their employment, again, in agriculture, manufacturing, construction. Most of the construction where I live now is done by, unfortunately, many of the undocumented migrants from Central and South America who came here because of the climate change, which has led to poverty in their country and destabilization from a lot of violence. But it all links together from climate. But they are now the ones here that are feeling the dangers from heat. So as we talked about in our social determinants of health, policy matters. And we know for the US, one of the huge policies was when the decision made to create people that were slaves. And from that devaluation of a community, of a group of people, that devaluation led folks to have less access to wealth, live in certain areas, and be subject to housing restrictions that go way back, not just the redlining of the 50s and 60s, but in many of our communities from Jim Crow days in the South to where Blacks could live. And in my community, Blacks were relegated to the railroad tracks because that was the worst land. Now, in the US and where we are, railroad tracks are now high ground. So what used to be bad land is now desired. But that sort of segregation goes back for many years. And when we look at where the heat in most of the cities, it is often in the racist policies that left housing and left many of these neighborhoods sweltering. And again, we say what drives this, we know the areas that is number one in generating these greenhouse gases. Agriculture, well, transportation is number one, agriculture, manufacturing, which leads to this incredible consumption of goods and services. It's not enjoyed by the folks who are feeling the most pain. So where do we get to? So we get to clinicians. And clinicians are absolutely the most important part of this puzzle, because we have 1 million physicians, over 4 million nurses. When you add the pharmacists and all the social workers and all the people in our country, and just even extend it across the world, you're seeing a population that is at the front line working with people who can then help in identifying the heat, identifying the risk, identifying where we could make changes, and then communicating to the most vulnerable group or to everyone, and then advocating for action, because as we understand, we have a way of, I was the medical students and we talk, and we say that when you think of the power that a clinician has, especially a physician, which other profession do you have where you can take a total stranger that you meet and tell them, take your clothes off in a room, one person, and we're going to examine you. Now, our society gives us that power, but that means that they've developed a certain amount of trust in what we do, and we have demonstrated, hopefully, that we're here for the best interest. So one of the things we do is take that history, and that history is what helps us to assess fully what is happening with our patients. So if we move that history beyond that physical, the genetics, beyond that, the individual, and take it from the way of looking at the individual, but that individual exists within our community, within the society, and we redo our history. So when we ask the history, we're finding about what is the social community context that this person existed, because we know that's what drives their health outcomes. So what are the support systems that they have in their home? What are those isms they're enduring, the racism, the sexism, the transphobism, and what policies are driving how this person lives? So I see my patient who comes in, like Miss Anime. She was one of the few Black women who had gotten a job in the government industry when they were forced to hire more Blacks in the 60s. But her job didn't give her a huge pay, because we know Blacks make 59 cents on every dollar. But she was able to get a little pension, and she bought a small old house. But she was relegated to communities that for hundreds of years said Blacks live here, and that's where she bought her house. But that left her without enough resources to really do well and survive and thrive in our warming world. But healthcare access, that's really important. What access does this patient have? Did the person have insurance? Can she get to the emergency room? Can she even get other resources? Because she needed a breathing machine. What kind of systems with that? What makes you vulnerable in the heat? Education, just how much education did she have? When I have my literature in my office, was it at the appropriate level? What is the health literacy? So as I'm getting to know my patient, I need to know these factors and see how does it relate to heat. How can she pay her utilities bill? Can she get water? Is the water clean? Is there shelter for her? Can she, when it gets real hot, is there a cooling place for her to go? Does her library, is it close by? Does she have a mall that she could go to? Does she even have transportation? Does she own the transportation, or does she have to go to the public buses? In South Florida, half our bus stops are uncovered. And you can imagine when you get to 90 and 100 degrees, I have a picture that I didn't put in, where the person was sitting at the bus stop waiting on her bus in the heat. And then the neighborhood and the built environments. What is their housing? Is it safe? What's going on in our communities that will drive this person's heat vulnerability and increase their risk of dying from heat? We do have to prepare our patients mentally and physically. We have to understand what acclimation, what they have, just the basic educational needs of these patients. So as we talk about preparing our patients mentally and physically, that's where we're going to learn about what are heat advisories. How do they check? How do they know what's going to happen? How do they prevent dehydration? How do they see cooling? What is the buddy system? When I have a person who comes in to work, I know they work on the outdoors. Who works with them? Who's going to check in on them? These are the simple things that you probably didn't take before in your history as you talk to your clients. And who's going to monitor them? You have an elderly patient who you know lives in substandard housing because you just did the history. They live in substandard housing. They can't afford to run their AC. Who's their support system is going to check in on them? So these are ways we now have to, as clinicians, to reorient our history taking. So we move beyond what's going on with your lungs. Do you need an inhaler? To looking at the patient in terms of the social determinants of health, because those are the things that's going to keep that person alive. And again, we have to look at our systems that we work under, like the health advisory guidelines. How many of us know about our health advisory guidelines for our communities? Some of these communities, like South Florida, before the alert goes off, it's like 115 or so degrees, which is really way too high, because by the late 80s, if you're indoor and you're elderly and you're starting in an index of 80s to 90s, my patient with congestive heart failure, COPD, may deteriorate. The electronic health records, are we bringing that into the fold? How can we put in alarms so we can have that nurse capture some of this information for us? And so the nurse will always, if that person comes in just feeling a little weak and tired, maybe it's more than that they work too late. Maybe it's their house is so hot that they're not sleeping well at night, and maybe they're getting dehydrated. So these are the prompts that could be involved into our systems and our entire supply chain in the health. Even if you're in an office, where do you purchase your materials? Have you looked at My Green Doctor to learn how you can decrease your carbon footprint, so then you can know that we're helping our community from stopping the warming? How do we incorporate telehealth? Because if your patient has to be on a 2-hour bus waiting in the heat, perhaps that patient may qualify for telehealth services. And that may be something that you would offer and prioritize some patients for different systems. So we're looking at a systems level. You can go back and reevaluate everything you do, look at an individual level, see how we can prepare our patients and our systems for heat. And I bring in the heat advisory guidance because the National Weather Service will start doing this when you have maximum temperatures expected to be 100 or higher for at least 2 days, and nighttime temperatures will not drop below 75. But these are heat advisories that may not become an emergency that will then not trigger some of the responses and the protection for our community. So these are areas that we as a community now have to push to say, where do we get the protection? Where would it be an emergency? So if anything happens, your hospitals, your systems can get dollars to come in and assist you and assist our patients. Again, because this is based on your ability to feel comfortable in heat, and that's what we call acclimation. Certain areas of the country that's used to heat, like South Florida, they might be able to go a little bit longer before they feel the heat, while places in the Northeast, because they just came out of winter, spring, and then a severe hot day shows up 2 days in a row, they may not be ready and they may qualify for a heat emergency. So there we have to look at heat and the advisory guidance very differently as we move forward. Because as we saw from the concerned scientist shows, we're anticipating many, many more days of heat compared to what we have. As a matter of fact, the National Weather Service is now changing what's average temperature to accommodate the last 20 years of rising temperatures. So now our average temperatures are higher. So then the trigger for the heat advisory, when you think about extreme heat, it's based on average temperature. So we have to go beyond the average and start looking at how we get guidance at a lot higher levels. The heat advisory guidance is even more so for children who tend not to be as outdoorsy and physically active as they used to be. And so you take this child who may not be as acclimated, that they get put outside for too long with some of these days, and you may have more danger for the children. So we have to restructure and reevaluate how we assess heat risk as we move forward. And again, when you look about index of 90, that's when we start worrying about our outdoor workers, children and elderly at 100. But remember, it depends on how you've acclimated to heat and where you are in the whole continuum. So by 100 degrees, we really should see the heat index when it feels hotter than it is. We should start seeing these alarms go off. And what do you have in your systems to get these alarms in this to alert your population? Again, doctors, clinicians, we are the best messengers, nurses, pharmacists, doctors. And so we should use this power to be able to protect and prepare our communities. Again, educate, engage, advocate. That's exactly what you guys are here. If you're part of our climate on this call, I'm sure you are very much aware of this. And we can only use this as the foundation, because from this, we must get action. And as the action comes again, is how are we going to get the curriculum? How are we going to get more research? We have to get the payment, and we have to really remodel and rethink how we see medicine, where the social determinants are just as important. So your evaluation of your patient's policies is just as important. So there is some economic and social justice in what we do. And that is considered healthcare. And that's how we get to this sign where we take it to equity and not just consider equality. And it's the same system that equity in what we do in terms of heat or anything benefits all of us. If you're out there, Florida Clinicians Climate Action, we want all of you to join. And in May, we're having our heat challenge, which we want to take over the internet. We want our nurses, our doctors, any health profession coming on, sending us a 15-second clip that you did audio. We have all the prompts. We want it on social media. We want it everywhere to sound the alarm of what heat is doing to our populations now, not 10 years from now, not 5 years from now, but right now. And I always say this, I close with Jorge. He is real. And Jorge is an outdoor worker, or he was. And he did this because he was very sick and dying at the time, and he wanted to leave a message because he worked so much in the heat. And his kidneys were failing, but he had to work because he was undocumented. That's his house. You can imagine what the internal temperature of that place, what was like. And his cooling was often, he'd come to my clinic, and whenever I'm there, if it's hot and Jorge needs to walk in, I would see Jorge, because I know there's nowhere else for him to go for cool, because at night,
Dr. Holder, your screen is frozen. So perhaps we should just go ahead. I know that this is the near the end of her presentation, and we certainly appreciate her giving such an informative presentation, not only covering the problem, but offering solutions that are accessible to low-income people. Now I'd like to turn it over to Jeannie.
Well, first of all, I want to say that that was incredible, and I'm really grateful to Dr. Holder for that amazing presentation. And I also want to reiterate what she said. I'm with the Farmworker Association of Florida. We're a grassroots organization in the state. And we have been trying for years to reach out to healthcare providers because we likewise feel that healthcare providers are key in the health and safety of farm workers and rural communities. And one of the big problems has been all along that farm workers, that healthcare providers often are not trained in or aware of occupational and environmental health issues. So we've done trainings with healthcare providers in the past. And so we're really thrilled to be able to be here to talk to all of you today. I am going to go through the slides, but I also feel that stories are the most impactful. Let me also just say that you might have seen my picture. That's obviously not me, but I have a personal policy that farm workers have been invisible for generations and decades. And I feel like that I am not the focus of this. Farm workers are the ones that are standing behind me, beside me, all around me. And I am here as a spokesperson for the people whose faces need to be seen, not mine. So with that, we'll go ahead and get started on the next slide. So one of the, that one, thank you. One of the things that's really important to understand is in talking about health and especially around heat, too often rural communities are not on the radar screen. There's a lot of talk about heat in the cities and how hot it is with people in urban areas where the concrete, the heat reflects off the concrete and makes conditions really hotter. But I just want to say that it's really important to understand the reality of the conditions in rural communities as well, and the workers in those rural communities who are exposed to heat. So let me just start off by saying everybody's got to eat, right? And if you eat, and I think all of us do, in some way you are intrinsically connected to the people who harvest our food. And yet, if you could go back, thank you. And yet these people are often the invisible ones. We've been really excited now because for the first time, we've been talking about this for decades and decades, but now with the pandemic, we hear that finally farm workers have been called essential workers, even though they're still treated as being dispensable workers. But who are farm workers? We're not talking about farm owners, the people that own the land, own the capital, make the money. We're talking about the laborers who they hire to plant, harvest, pack, and distribute their food to all the rest of us so the rest of us can eat. And the farm workers in Florida today are largely Black and brown people of color. They make some of the lowest wages in the country. Farm work is one of the most dangerous occupations in the United States today. They have limited education or no education at all, no formal education. A lot of them today are undocumented Latinx and Haitian workers who might have little or no English language proficiency. They're subject to harassment, intimidation, discrimination, and exploitation in the workplace. And as Dr. Holder was saying, you need to understand the social determinants of health because those things all add to stress. Some of them are victims of labor trafficking, and that's a whole issue in itself. Most of them don't have access or money or resources for childcare. Sometimes children are brought to the fields with the parents. They don't have benefits. The vast majority of farm workers do not have any health insurance. They don't, a lot of them, if they're undocumented, don't even qualify for Medicaid. They don't have workplace benefits, no sick days, no pension plans, et cetera. And these are often marginalized rural communities. And again, the vast majority of them are undocumented. And next slide, please. It's also really important to understand who farm workers are. Farm workers are really people that are living the legacy of slavery. And that's not just a term. We've been saying this for decades as well. And until the racial crisis that arose last summer, people weren't talking about that. But I'm really glad that finally, at long last, people are getting the direct connection between enslaved peoples in this country and conditions in the United States today. And farm workers today are living that legacy, because the first quote unquote farm workers in the Southeast were enslaved peoples on plantations. The people that harvested the food that made the money for the plantation owners that then was able to build this country, because the food and the cotton for clothes were sent all over this country for the Industrial Revolution and for building the country. But what kind of conditions do they live and work in? So farm workers work outside, maybe in a greenhouse. They're subject to heat and to cold and to storms. They're also subject to pesticide exposure. There's snakes, insects. In California, they're subject to smoke and fires, dangerous farm equipment, long work days with few breaks. Farm workers are paid by the piece. They're not paid by the hour. So they're incentivized to keep working without stopping. So for example, you saw the picture, or this picture right here, of the workers in the corn. Again, they're not paid by the hour. They're paid by how much corn they pick or how much corn they pack. And it's checked off on a little list. And the crew leader checks them off. And if they're not meeting production, then they can not be called back the next day to work. So they're incentivized to keep working faster and faster, which when it comes to heat, that means further exertion on the body. Sometimes there's no bathrooms in the fields, no drinking water or no water to wash your hands. Even though there are regulations that there should be drinking water, sometimes the drinking water is a quarter of a mile away. And if you're working piece rate, you don't want to stop and walk a quarter of a mile to get water. They often live in substandard and inadequate housing. I didn't put any pictures in here, but some of the farm worker housing is just horrendous, as you saw in the photo that Dr. Holder showed. It's often in remote rural areas that's far from any grocery stores, any access to any services, a clinic. We have a phenomenon in Florida right now where a large proportion, an increasingly large proportion of farm workers in Florida come here on guest worker or H-2A visas. So they come here on temporary work visas. And this is a long story too, which would take too long to get into, but they're here temporarily. They don't have their own transportation. They're completely dependent on the employer. They're housed in barracks-like conditions in many cases. And they don't have access to places to cook. They're dependent on the employer for their food. So you can imagine what kinds of problems these create. Farm workers that live in this area often live in flood-prone areas, which makes them subject to floods from hurricanes because of climate change. And again, they often lack transportation to a grocery store. Next slide, please. And just to kind of emphasize the fact, I think it's extremely important to understand how farm workers are living the legacy of slavery and racial discrimination. There's a term called agricultural exceptionalism. In the 1930s, when the New Deal labor laws were passed, farm workers and domestic workers were deliberately and intentionally excluded from labor laws that included almost all other workers. Farm workers and domestic workers. Those are the two jobs that enslaved peoples did on plantations. They were domestic workers in the plantation owners' homes, and they were the workers in the fields. So that's food for thought. The National Labor Relations Act was passed. Farm workers were excluded from the right to organize and form unions. And that's still true today. Under the Fair Labor Standards, farm workers were excluded from minimum wage, although most states do pay minimum wage now, but they're still excluded from overtime pay. Many states do not cover them with workers' comp, although Florida does, and they were excluded from child labor laws, and that's been improved since then too, but the labor laws for children are still less for farm workers. And OSHA, farm workers were excluded, even though farm workers are exposed to toxic chemicals and they're exposed to hazards in the workplace, they're only covered under OSHA under the general duty clause, which basically says, don't harm your workers. Next slide, please. So it's really important to understand the environmental racism. If we can go to the next slide, please, thanks. That these farm workers are victims of environmental racism. The environmental justice movement started in 1973, and we've been involved with it ever since. And I'm again so glad to hear the environmental justice movement's been around a long time, and it's only recently that you're hearing about environmental justice. And this administration has taken a real active role in being committed to environmental justice, which is thrilling and exciting. But in the meantime, farm workers have been victims of environmental justice for years, and that includes exposure to chemical pesticides and fertilizers, and workplace heat is just one other factor. And these, I think these pictures are very important to see. Please observe the conditions in the workplace. And also you can see the bus that they're transported in, which has no air conditioning. Next slide, please. So a little bit about the farm worker reality. There's approximately 500,000 children working in agriculture today in the United States. And the majority of children that are working are about 70% of them are children that work in agriculture. Nationally, women make up 22% of the agricultural workforce. In Florida, that's much higher. We have a lot more women working in Florida, and that's increasing every year. And it's important to understand the drivers of, and Dr. Holder mentioned this in her talk as well. You can't really understand environmental racism or environmental justice without understanding some of the factors that are driving this. A lot of farm workers in Florida today are from Guatemala, El Salvador, Honduras, Mexico, and Haiti. And think about that. Those are all countries that were subject to hurricanes that have been exacerbated by climate change. And a lot of people coming to this country are climate refugees. So we're talking about not only environmental justice, but climate justice. And I want you to take a look at that picture when we're talking about heat. So one of the things that farm workers have to do is to protect themselves from pesticides. So to protect themselves from pesticide exposure, you can see this woman is in a fernery under shade cloth in the sun. She's wearing long sleeves. She's wearing layers of clothes. She's wearing a plastic bag around her body. The plastic bag is to keep her dry and to keep, because the ferns are wet, sometimes wet with pesticides. They wear gloves because they have to use their hands all day long. They wear a hat. A lot of times women will wear a bandana around their face because of sexual harassment. It's protection against sexual harassment. When you're working in the fields, you really should wear boots because you're also exposed to pesticides and you're tramping around in the soil, and your shoes would get wet in just a few minutes after working there. So imagine working in the heat in those kinds of conditions. And next slide, please. And so I wanted to show a picture here. Heat is the largest killer for weather-related killer in the United States, and outdoor workers are especially at risk. Look at the pesticide applicator in the picture there. Imagine having to apply pesticides in Florida in the heat, and to protect yourself, you have to wear a full body suit like that. Okay, a lot of farm workers, because of the heat, they don't want to wear full body suits, so they put themselves at risk for pesticide exposure to be able to avoid heat exposure. And I'm going to throw in a little story here right now. I think it's really important. Actually, we talked to a reporter yesterday who's doing a story on heat. And we were telling him about Eladio. This was about 4 years ago now. And I was at the office and got a call that some family members were calling me frantic. The story is Eladio was a pesticide applicator, like you see in the picture. He was wearing a suit like that. He was applying pesticides on a hot summer day in a nursery inside a greenhouse. He started feeling sick. He came out. His wife worked in the same nursery. He said, I don't feel good. And he reported it to the employer, and the employer said, oh, you'll be okay. Just sit down and relax a minute. Well, he felt worse and worse and worse. Technically, the employers are supposed to provide transportation to the clinic or to a healthcare provider, and the employer did not. Eladio started getting worse and worse. Finally, they said, well, here, go to this clinic, and they gave him a name of a clinic. His wife had to drive him to the clinic, and as soon as he got there, the clinic said, go directly to the hospital. Well, he was hospitalized, ended up in a coma. And I was there at the hospital when there were tons of family members around him. He was in a coma for several days, and he ended up dying. It was reported to the Department of Agriculture and the Department of Health. After about 2 years, they determined that it was a combination of heat and pesticide exposure, and they fined the company about $1,000 for a man's life. But next slide, please. And that still upsets me to this day. I know some of the people that know him, and it's very disturbing. So farm workers have a special problems with heat exposure because of exertion. So there's actual heat there's environmental heat, and there's exertional heat. So as you know, if you're working, your body, if you're doing strenuous work, your body generates its own heat, which actually can raise your core body temperature. And then a lot of time, and the duration of the physical exertion is also an issue. And then a lot of times farm workers will go home to a house that has either no air conditioning or not adequate air conditioning, so they don't have a chance to cool down. Next slide, please. I'll come back to the story of Maria. We're not going to go over this because Dr. Holder pretty much mentioned this, but the heat does affect the whole body. And these are some of the symptoms that can happen from exposure to heat. And next slide, please. And the Farmworker Association did a 4-year community-based study about the effects of heat on farm workers with the view to looking at kidney failure. Because there's anecdotal evidence, well, no more, it's not anecdotal anymore, about the high incidence of kidney failure among farm workers. So in this study, we had some pretty state-of-the-art equipment. We measured, we did it in, I think there were 200, it's close to 300 farm workers that we worked with in 5 areas of the state. We monitored the farm workers for 3 days. They came in on a Sunday, and we did baseline measurements, including urine sample, blood, weight, etc. And then for 3 days, they wore this equipment. And then at the end, we did an exit survey about symptoms, and also downloaded all the measurements into a REDCap. So each farm worker was asked to swallow a pill that would eliminate from their body. They would swallow the pill once every day for 3 days, and the monitor up there would, that pill would generate a signal to that instrument there that would record their core body temperature at so many intervals, seconds throughout the entire day, so we can measure core body temperature. Next slide, please. And then they wore an act graph around their waist, and luckily they could hide it under their clothes so the employer wouldn't see it. And that measured their activity, the amount of stress, movement that they did during the day. And then the other piece of equipment was a heart rate monitor, which you can see on the picture on the right. Next slide, please. And then we we had heat buttons that would measure the ambient heat inside the greenhouse or the field where they were working. And then we would give them thermometers to take home to measure the temperature in their house. And then we did urine samples every day and blood samples to look at levels of dehydration. It's more complicated than this. I'm going at it kind of fast, but I'm happy to take questions afterwards. So next slide, please. And so we got lots of data. Here's a compilation of data from the 5 different sites. Of the people we studied, 53% were dehydrated before work, and 81% were dehydrated after work. Only 10% maintained a normal body temperature throughout the whole day. And we used 100.4 Fahrenheit as the limit, although some studies use a higher body temperature, but 90% of participants exceeded the heat stress level on at least one day. We measured symptoms, and I didn't list all the symptoms here, but 42% said that they had at least 3 or more symptoms on at least one day. And then 36% developed acute kidney injury on at least one day. We're doing a long-term study now. We're continuing the study with Emory University, where we're monitoring farm workers over a 4-year period to look to see if there is decrease in kidney function over a period of time because of the acute injuries they experience on a daily basis. Next slide, please. So without intervention, excessive heat can lead to stroke and death and permanent organ damage. So let me just say here, too often, people tell us, oh, well, you should train the farm workers to protect themselves. Oh, you should give them this information on how to protect themselves. Well, that's true, okay? But the farm worker reality is that they have very little agency. They are forced to work, they're incentivized to work very hard and fast. A lot of them are afraid, even if, first of all, most of them don't know their rights. Even if they know their rights, they're afraid to speak out about conditions in the workplace. They're subject to intimidation and harassment. Some farm workers wear diapers to work because they don't want to walk to the bathroom, because a supervisor or an employer will say, where are you going? It's not break time yet. You can't go anywhere yet. You've got to, you got to keep working. You go to the bathroom when the break time comes. Next slide, please. So these are some of the realities. So we do train farm workers. We tell them to drink enough water throughout the day. And let me just say that people remember all the problems there were with contamination of food, lettuces with E. coli, et cetera. Well, there are food quality protection measures now to protect our food, but not our farm workers. So very often in many farms now, farm workers are not allowed to take water bottles into the field because of food quality protection. They care more about the food than they care about the farm workers. So these are just some things that we tell farm workers to do to protect themselves. And next slide, I am coming to the end. So these are some of the solutions. We have a training for farm workers on heat stress and pesticide exposure. We've created videos and materials for farm workers on recognizing the symptoms and protective measures they can take. We have a social marketing research project where we try to involve employers in protecting their workers. Healthcare providers are key to diagnosing, treating, and preventing heat stress. And we work with allies around the state. 2 real important things. You can go to the next slide. We're also working on state policy and national policy. You can read this for yourself, but we're trying to push policy at the state and national level to protect farm workers. But I just want to say that Florida, the military has lots of money. And they have preventive measures and monitoring for heat stress in military workers. Florida last year passed a law to protect students, athletes, okay? But what about farm workers? They still haven't passed anything for farm workers. I could talk a lot more, but I'll stop there and welcome questions and comments. Thank you very much for this opportunity. Thank you.
And thank you so much, Jeannie Economos and Dr. Cheryl Holder for both of your presentations. I think a lot of people don't think about the effects on low-income people, but particularly farm workers. So now we'll take questions from the audience. I remind you that you can type your questions into the chat box and we'll get to as many as possible. Bev, can I have the first question, please?
Yes. Sorry, I couldn't see the question, so I was sharing the screen. But really incredible presentations. Some of them incredibly mind-blowing, what we just heard. So, okay, let's see. I think we had a question just around from Dr. Walden about how is this legal? A lot of the conditions that farm workers are working under are laws actively being broken, or are they actually operating in a very unjust legal framework, or both?
Well, they're working in a very unjust legal framework, but also the laws that do exist, we find violations so many times that one of the things, I work a lot on pesticide issues, and I was just on a call with EPA just before this. We were complaining about lack of enforcement and compliance and violations of pesticide regulations. So it's a constant struggle regarding heat. There really are no, we've been petitioning OSHA for a long, long time. OSHA has guidance on heat stress, but no regulations. And we work with a network of groups all around the country. A lot of that is led by Public Citizen, Farm Worker Justice, United Farm Workers, to try and petition OSHA to get national regulations on heat stress. And so far they haven't done it. I saw a quick question, if I can just say, we're also very concerned about the compounding effects of exposure to heat and pesticides. If you're breathing heavy, are you inhaling more pesticides? If you're sweating more, are you absorbing more pesticides? So there's a whole big area that needs to be studied and avoided about exposure to both heat and pesticides simultaneously. Thank you.
So, yeah, thank you so much, Jeannie, and I appreciate your wanting to lift up the workers and have their face there. Can you? I had a question about the number of deaths. Do you have any idea about the number of farm workers who die each year from heat?
We really don't know because there's vast underreporting. If I can just say one story that about 4 years ago, a farm worker in Immokalee died from heat exposure. He'd only been working in the fields for 2 weeks, so he was not acclimatized to working there. And they were picking tomatoes, and he kept telling people that he didn't feel well, and they said, "Oh, just go sit down there in the shade." And he was on a 2-hour bus ride back from the fields to Immokalee. And when they got back to their place in Immokalee, they shook him and he had died in the bus. That was reported, but we know of other incidences that are not reported because people are undocumented and they're afraid to report it. So there's vast underreporting. I don't know of any numbers that are, and even the numbers that there are probably very low.
Thank you for that. I had another question before we go back, and that is about student athletes. So Dr. Holder, tell me what we see with student athletes and military.
Well, like Jeannie said, the military is very, very well prepared, and they do because they wear all the camouflage, all that stuff, but they have the systems in place for monitoring the buddy system. They have everything in place, so you don't often hear about it as much. In Florida, the athletes, the training has really improved. What we see is the acclimation period. So if you can get the student before they get to monitor them closely, as they acclimate to the temperature, then we will see. There was a Tampa Bay athlete who died, and with that came the legislation that improved the conditions for our athletes. So the ones that we have more trouble with are the ones that are not in the formal athletic, not like the school teams, but the smaller versions, the Optimist League, and that are coached by folks who may not have the same training. So that's the newest group that may be a little bit more vulnerable. But the athletes have gotten more education and more monitoring, which is the key. There was a time I felt it was the dreadlocks and this football helmet that just made them super hot. Then all those kids were dying from all the heat. But we're seeing an improvement with the athletes, but we definitely need, with the weekend athletes and the kids who are not in the most formal of the athletic programs, we still need work there. And that's where pediatricians and nurses, they have a big role. And outdoor workers, not simply, you have the farm workers, but we have a lot of different outdoor workers in South Florida. If you drive here, there are flower vendors and fruit vendors on the street corners everywhere. And the construction work. And it's the same thing when you're in a right to work state. That's very few employees want to complain. And so they often tolerate the conditions. And even though it's legal per se, if you look at the paperwork, the employers supposedly have the safe workplace. But in practice, because of the pressure to produce, especially with our construction industry and behind, they don't complain and they don't take their breaks.
Thank you so much for those insights. Bev, do we have any other questions?
I have a question for Jeannie about that research study. That was incredible where you swallowed the thermometer. How was the consents being done? How were you able to get folks to consent? And what is the next step in that study?
Well, that's one thing that's good about being a grassroots organization, because we've been around for a long time and we know people in the community and they trust us because we have relationships with them. And I think if you just went into a community and just asked people to do it, they would go, no, I don't think so. But people know us and they trust us. And so they were willing to do it. So there have been several iterations since then. Right after that study, we did a pilot study where we had farm workers wear a cooling vest, and then some wore a cooling bandana around the neck, and some wore both, and to see which worked the best. So that was a pilot project in between, and then we had another. So now we're in the third phase of that project, which is looking at the kidney study. And that's a much smaller cohort of people that are in the long-term kidney study. But we also have some other projects outside of that intersect with that. But it's been ongoing work with Emory to look at, the main focus was kidney failure.
Okay.
So thanks so much. I know we can continue the discussions for much longer, but we need to wrap up this session. So I'd like to thank each of our speakers sincerely, and I would like to thank all of you for participating in this month's webinar. I hope that you found it useful. Next month's webinar will be on food and water, and I would encourage you to register and attend to if you're able. We'll send a follow-up email after this webinar with a list of recommended readings on the topic of extreme heat. Before you leave, we ask if you could take a moment to fill out the webinar survey. The link is now in the chat. And we'd also like to thank our sponsors, Johnson & Johnson, the Energy Foundation, and the Robert Wood Johnson Foundation for their generous support of our Climate and Health Equity Fellowship Program and of this webinar. Now this concludes the session. Have a wonderful day.
Thank you.
Thank you very much. This was wonderful. Thank you.
Yes, thank you. And I'm hoping our speakers will be able to join our fellows after this.
Thanks so much.
Yeah.
Thanks, everybody.